health alert tonight. There's plenty of sunny days in our forecast this week, which means you'll want to be protecting your skin from damage.
ABC 17 Sarah Masserdonar joins us live in studio. Sarah, skin cancer is one of the most common cancers in the U.S.
The good news, Joey, is that it's completely preventable, but that starts with taking care of your skin, even when you don't think it's going to be at risk.
There are 5 million diagnosed cases of skin cancer a year, and the American Academy of Dermatology Association says melanoma, the deadliest form, kills 1 person every hour.
For being a preventable cancer, we see far too many cases still to this day of melanoma that has spread elsewhere.
When it comes to developing skin cancer, the sun may be the biggest enemy. One blistering sunburn during childhood or adolescence can nearly double a person's chance of developing melanoma.
But even when it's cloudy outside, UV rays are still a concern. A 7 or an 8 is high. Tomorrow it's going to be cloudier in the evening in Columbia, but it's still sitting at a 5 for the UV index. And while the temperatures are going to be cooler throughout the day, there's a 7 UV index, which means there's a high risk of harm from the sun.
This is when we see a lot of patients coming in with some of their worst burns are on the cooler days. When you think it's not warm, it doesn't feel like summer yet, I'm just going to run out and do my thing.
You can use sunscreen daily, but protective clothing will also do the trick. Wide-brimmed hats, sunglasses, clothing with UV protection built in, and seek shade when you can. And also do a self-check. Dr. Smith says you should look for the, quote, ugly duckling on your body or sores that won't heal.
If you have something on your body that looks like nothing else on the rest of your body, if it's your ugly duckling, if it stands out from the crowd, then that is something that should be evaluated by a primary care provider or a dermatologist.
There is some concern about sunscreen chemicals entering the bloodstream after some studies were released. Dr. Smith tells me further studies are needed because they don't know quite yet if what's getting absorbed is actually unsafe. There is information on our website, though, that can help you figure out which kind of sunscreen might be best. And again, protective clothing will always work.
Good advice, SMD. Thank you. The Ellis Fischel Cancer Center will have free screenings, by the way, May 23rd from 3 until 6.